Heat emergencies and heat casualties. We gotta take into account the environment that these patients are in. A lot of times, the environment and humidity, the temperature and humidity, that climate in that environment is high enough that we end up losing the ability to thermoregulate. This means the body's ability to disperse the heat and to lose the heat by producing sweat and that evaporation, also using the air around us as convection to cool us down. The climates that we are in, where they're highly heated, tend to hold the heat around them, and so we get this radiant heat from the environment and objects that are around us. Remember that the humidity of that environment can increase the temperature that our patients may suffer from. Well, we have three different categories of heat-related emergencies. The first one is mild. It's more of a heat cramp. This is where we're losing a lot of sweat through our physical activity. In this case, you see the slide where they're running, but it could be any type of activity in the outdoors where the environment's hot and the sun is up and they're wearing a lot of restrictive and heavy clothing. What happens is the person starts to sweat and we lose a lot of electrolytes through our sweat as we try to cool our body off, and this will produce some type of muscle cramps. Usually just drinking a lot of water, not necessarily having to replace those salts or electrolytes, but just a good healthy diet and adequate hydration can minimize or decrease the risk of having heat cramps, as well as being acclimatized to the environment. Our second medical emergency is heat exhaustion. This is a milder phase of being exposed to the heat and the body's almost inability to maintain that thermoregulation. The patient now succumbs to the climate, and the patient develops a lot of sweating going on and some tachycardia, as well as increased breathing rates, so tachypnea. But the body is trying to thermoregulate and cool itself down. Now, the person feels fatigued and may have symptoms of dehydration, where they're losing a lot of volume from excessive sweating and lack of intake. So there may be some lightheadedness, some nausea, some vomiting. Now, the last and more detrimental phase is heat stroke. And in the past, this was more recognized by the person that was in heat exhaustion, now lost the ability to sweat and started to turn red. That is somewhat of the case, but we're not particularly using that anymore. What we're looking for is once the patient starts to become disoriented, confused, we're taking the mental status into focus in heat stroke, because we know that given the ability to sweat or not sweat doesn't have much of a play in cooling them off as would and affecting their mental status, rather. So affecting their mental status. So once they become confused or disoriented, may or may not lose consciousness, this will give us a high risk or a flag or an indicator that the patient may be suffering from heat stroke. Now we look at taking temperatures, and the most accurate temperature to take would be a rectal temperature. And so we're looking at doing these in the field. If it's above that 103 to 104, 105 and higher, when it gets to 106, we're starting to actually cook off cells and the organs will start to fail. And what we're really afraid of is that because the body's core temperature is that high, that these organs will fail and the patient will actually not do well if we're not actively and rapidly cooling them. So again, take into account the activity, take into account the climate, take into account other factors such as preparedness and acclimatization, as well as hydration status and physical attributes or conditioning. Given those factors, we start to look for heat cramps initially, where we are losing electrolytes that cause these muscles to ache and cramp. Easily treated by adequate hydration. May or may not have to have any type of supplements, but to reduce the activity until we're hydrated enough. Heat exhaustion is where the body is now overheating, but not in severe overheat, as in heat stroke. We want to remove them from the area, cool them down, and if they can tolerate, we'll start to give them some PO fluids, but definitely starting to remove them from that environment, lessen the activity that they're doing, release and loosen any restrictive clothing, and have them cool down in a cooled environment. Now, when it comes to a heat stroke, we're looking for the altered mental status changes, and not necessarily the reddened skin and the decrease in or the inability to sweat to cool the body down. This is extremely critical phase, heat stroke, and the patient needs to be cooled down rapidly. And so the recommendations now are to have them in an immersion bath. This is a large tub of water filled with ice and water, and to keep them in there until their body temperature gets down to about 101 before they're even transported or removed from the scene and transported to the hospital. Of course, they're starting oxygen and perhaps initiating other ALS interventions is required, but what the basis here is to rapidly cool them and remove them from this environment.